All right, everyone, welcome to the August Brightly Thrive Workplace Wellbeing Skillshare. I'm Hannah Jade Watson. I'm the community host for the Brightly Thrive app. So I'm really excited to be here with you all and share about my former career, music therapy. I absolutely love where I am right now as the community host, and I feel like I've gained so many skills over the years that I'm able to share in this role, continue to grow, continue to evolve. But music therapy was where I started. That was my college degree and my first career. And it really did form such a strong foundation for me professionally, personally. And I can't wait to share more with you all today and anyone watching the recording. So thank you so much for being here. If you have any questions throughout the presentation, feel free to use the chat feature. I'll definitely check on those towards the end of the call, but don't save your questions. Go ahead and send them so you don't forget. And I can't wait to share more with you today. Awesome. All right, I'm going to share my screen. 1 second. All right. So welcome to Music Therapy, Stories of Connection and Hope. I'm Hannah Jade Watson, and it's been such an interesting journey to get to this point as community host. As I said, I started out my career in music therapy and absolutely loved the field and the path. And then life brought me to this winding journey with my health and my well being. And now I get to help other people with autoimmune disease thrive. So I really am right where I'm meant to be, but I still get to use music in my daily life as I also have a private teaching practice where I teach instruments and singing lessons. So that's how I continue to use my love of music and the skills that I developed over time in my daily life. And of course, all the things that I've learned apply to where I am now. So, yay. All right, so what on earth is music therapy? Music therapy is the use and the magic of music and the therapist's professional skills to address non-musical goals. So goals that are social, emotional, mental, physiological. There's a wide variety of goals and objectives that music therapists can address with music. So the power of music is so innate to us as humans. We started off in our mother's womb with her heartbeat as a consistent musical pulse in our memory. As we were forming our ears, as we were able to hear, we heard music for the first time. It was that steady pulse and beat. And then we entered the world, and there's music everywhere we turn. There's music playing in stores, there's jingles on TV, there's music that informs the tone of movies and TV shows. And we each form our own relationship with music over time, especially as we grow and develop. We have our own unique musical preferences. We have our favorite artists, our favorite songs, and they can evoke memories and be connected to different times in our life. So, as music therapists, we use the magic and connection that is music. It affects every part of your brain. It is one of the few things that actually activates many different regions of your brain at the same time. So it can be long lasting, even in memory loss, even in different traumatic injuries to your brain, to your body. So it's a really powerful tool that we can use to help people and help them grow and change and feel more settled in their body and their mind and spirit. So it is a college degree, and it is a field of study and very serious research, very serious study. So you go and get a bachelor's degree in music therapy, which is a 4-year degree. You come in with a principal instrument. So mine was voice. So you can use singing as your principal instrument. You study that intensely. You have to prepare a recital and take weekly lessons to hone this instrument, whether it's voice, whether it's trombone, whatever it may be that you come into the music school as your audition. And then you also need to proficiently learn guitar and piano. So these are two tools that we use in music therapy sessions to play and sing the songs for our clients and our patients. So I had to study guitar and piano for the first time, become really proficient in those. And also, we study psychology, abnormal psychology, and apply all of that to the music therapy model. And after we complete our 4-year degree, we have a 6-month internship as well. We can choose the patient placement or population that we choose to work in, and we hone our skills in that one setting for the 6 months. At the end of that time, you can sit for a certification exam, and then you need to renew your certification every 5 years with continuing education. And the field is constantly changing. They're constantly doing more research and involvement. So it's really exciting to see, even after I left the field, 5 years ago, how much it's changed since then. And I'm sure it'll keep changing over time. And we talked about the certification. There can also be a state licensure as well. So that depends on the state, but you might have to apply for an additional state license that helps you be able to practice music therapy. One really important thing for music therapy is the client preferred music. So classical music can bring a lot of emotions. It can help us relax. It can be really intense, but we also want to use any music that our patient or our client, whoever we're working with, really prefers. That could be rock music, that could be rap music, that could be country, that could be classical music. Whatever the client really relates to, their favorite songs, artists, and genres are what we really want to use. Because if you think about it, that's what you relate to the best. That's what sways your emotions the most. And that's what we can really connect with our patients and clients over. So as a music therapist, you need to learn a basis of a lot of different types of genres of music. And when you first encounter your clients, you want to see if there's any additional songs or genres you can expose yourself to and learn, so that in the music therapy session, you are providing their preferred music and they're enjoying the experience to the maximum amount. And populations served are vast and innumerable. They increase every day, I swear. So birth to end of life, all the ages in between. The medical field is very prevalent. Hospitals, hospices, nursing homes, rehab facilities are just to name a few. Also in the education setting. So we can actually go into school settings as well to help work on social emotional skills and also educational skills. So if we want to help students learn, we can use music to help do that. I don't know if you guys know of Schoolhouse Rock, but that's a good example of a learning song where those songs just stick in your brain and you will never forget how to count by threes or your threes multiplication table. If you know the song, 3 is a magic number. So we can use different songs that either the music therapist creates or that, oh, I hope it doesn't break out with the internet. Let me know if it does. We can use songs that are already created, or we can write songs to help those students learn educational goals. We can also work with individuals with intellectual and developmental disabilities. Yes, conjunction junction. I love it. Yep, that's another one. Oopsie. What the what? Why did it go back so far? Oh, I guess it was only one slide forward. Yes. And so individuals with intellectual and developmental disabilities, we can help them work on those social emotional skills, also different life skills as well. We can pair music with getting dressed, brushing your teeth, songs about those things, or actually using music therapy to provide personal care alongside maybe an occupational therapist, a physical therapist. And that's what I forgot to put here. We can also work with a bunch of different disciplines so that the magic of music therapy pairs with the magic of other professions as well. So that can be really exciting. And that's something that I love to do as a music therapist, was work with other practitioners as they're trying to achieve their goals as well. So, and last but not least, psychiatry and forensics. So we can actually work with psychiatric populations and also forensics, like inside the prison systems, inside the justice systems. So those are a wide variety of populations. And we, as music therapists in our field of study, we're exposed to a little bit of each so that we have experience. And then if we really know what we'd like to do, that's where we specialize with the internship. But you can always get some professional supervision. Say you started in education and you wanted to transition to the hospice setting, you can actually go and observe a hospice music therapist. You can get some specialized training for a brief period of time and then be able to transition into that setting. And that's why we have that wide exposure in our undergraduate program that allows us to, yeah, be connected to all these different populations. So that was one really cool thing about school, is that not only did I learn all these instruments, all these skills, but also I was able to apply them in class, like in a closed classroom setting. We role played as different populations, group settings, individual, those type of things. And also we were able to go out into the community with our music therapy professors who were mentoring us at the time and be able to practice with a wide variety of individuals. We had to learn so many different types of music, and it just trains you to be very flexible and flowing in your practice. So I absolutely love the field for that reason. It's never boring, even if you are in, let's say, working with older adults. There can be a wide variety of music preferences or goals that you're going to accomplish, even just in that. So it can bring about a lot of change, a lot of flexibility, a lot of dynamicism. So I love it for that reason. And as I said earlier, music is such a source of connection and it's such a source of memory. So it's one thing that we can not only help individual clients and patients, but help them connect to families, help create special memories, and yeah, really bring about a positive experience, especially in a challenging time. So I wanted to share some of those stories with you today. All right, I wanted to check the chat if anyone had anything. Oh, never mind. Can't find it anymore. All right, so my first story is in the neonatal intensive care unit. So as newborn babies are born, and if they have any health challenges, they might go into this intensive care unit inside the hospital. And so this can be a wide variety of ages, even for the newborn babies, because a lot of times if they're born before those 40 weeks of pregnancy, they can have different developmental challenges or different breathing challenges, and they need a little bit more time before they go home to help develop, help strengthen their lungs, their heart, all of those type of things. So this was one of my favorite populations to work with because they're tiny babies and they're really, really cute and they're fun to work with. In the NICU, there are a few different approaches, but research-based approach here is to use guitar and soft singing as you're singing to the babies. So the client preferred music here is lullabies. Since the babies haven't really developed their own preferences yet, we're going to use traditional children's lullabies. And we do update those with time because the lullabies that I had when I was a kid are a little bit different than the classic lullabies nowadays. So we want to definitely update those with the times and what their parents may be singing or playing for them in the womb or outside the womb. So we do use really soft, gentle music with the babies. And we always monitor their heart rate, their respiration and breathing rates, and also their oxygen saturation rate. So that's how much their blood is being oxygenated by when they breathe in. So we would see a huge change physiologically in a positive trend for most all the babies that we worked with in the NICU. And through this positive stimulation, this positive association, we were able to help them tolerate stimulus. So if you think about, a baby being in the womb, they're protected from light, from a lot of sound, from touch. So as they're born early, they might really not want all of that touch, all of the light, all of the sound going on, but that's life. They're in the hospital, they're being cared for, they're being checked on by the nurses and the doctors and the different practitioners that are assessing them. So we as music therapists come in and we provide them positive stimulation. We're not, checking their blood pressure or taking any vitals or poking them with needles. We're really just providing them relaxation and a joyful sound. as they are in the NICU. And we love to also pair these visits when their parents are visiting, because I know this can be a very emotional time for the parents as well, because they want their babies to be home and really start that life as a family. So we love to involve family members and any siblings if that they're allowed back in the NICU as well. So that was a really fun thing. But we have a very prescribed way of assessing the babies and addressing their needs. But as I said, there was almost always a positive trend in their heart rate or their breathing rate. So most babies, as newborns, sit between 100 and 120 beats per minute. Their heart beats very fast for their new body as they're growing, as they're developing. But babies in the NICU, because they're overstimulated, because they might have some more signs of anxiety, they can sit between 130 to 150 beats per minute and even higher. And as we assessed them for music therapy, we would record their heart rate before we began the music therapy interventions. And then we would record it during and then after. And usually those babies would be at about 140 beats per minute. And during and after music therapy, they would settle more towards that 120 beats per minute. So it was actually a big change in their heart rate and decrease their heart rate, which is for them very positive because it helps them return to more of a baseline. They're able to heal and grow and develop safely without putting too much stress on their heart or their lungs. So this was really beautiful, and it was fun to hold the babies. So usually one music therapist sings and plays the guitar, and the other might hold the baby if they tolerate that, and also maybe provide some touch stimulation as we're singing the lullabies. So I loved working in the NICU. It was one of my favorite times of the week, and I just learned so much about medicine and about newborn development, and was able to assess different infants at different stages and ages. So that was really exciting. After college, I worked in the hospital, and this was with a wide variety of adults. So I might work in the ICU units where patients had just had significant trauma, such as like a motorcycle accident or a fall or something very significant that required high intensity medical intervention. And sometimes I would be in different step down units where they were recovering from a cardiac event or something like that. And they were getting closer to being very stable and able to go home. So it was a wide variety of even just populations there. And having a variety of adults in the hospital, there were age ranges that were all over the place. And it was, again, very dynamic, very exciting every day. You never knew what you were going to get as you were practicing music therapy. One of my favorite stories is that I had a patient who was end of life for lung cancer. So a very challenging situation, very hard situation. Again, I hope the internet doesn't cut this out. But his entire family was there. They were living out of state, and all were able to come and stay. I think they had something sort of like a Ronald McDonald House, but for adult family members. So they were able to have accommodations, be able to stay with him in his end of life experience. And I was able to go in and provide music therapy for him and his family. And it was such beautiful moments because they were able to share and reminisce about their memories with their family member and really connect over the music that they all shared, that they listened to together or that their family member really preferred. So that in itself was beautiful. And then I was able to do something very special for them, which is to record the patient's heartbeat. So we have these stethoscopes attached to a microphone, and we can actually record the heartbeat of the patient. And then we can even just give that particular track to the family so they have the memory of that heartbeat of their family member. Everyone's is so unique. And you can also add a song over top of that. So I was able to choose a song that they really resonated with, that they really associated their family member with. And I was able to play that alongside the heartbeat to the tune of the heartbeat. So that was a beautiful experience to create that for them, give them a CD of that. so that now, even though their family member is gone, they have that memory to hold forever, to listen to forever, not only the heartbeat, but also the song and the message that it conveyed. So that was such an honor. And there were many times like that that were such an honor for me as a human to be able to facilitate, to witness, to be a part of. And I am very grateful that I was able to be there. I also worked in hospice care for my internship, which was absolutely a fabulous experience. Such a challenging time of life, but it created such beauty. It opened up conversations, it opened up vulnerability and honesty. And I worked mostly with patients who had memory care diagnoses, so dementia, Alzheimer's, at the end of life stages. And those disease processes can be quite confusing. They can show a steady decline over time, they can be a rapid decline. So it really just depends. So a lot of times when someone is diagnosed with a memory impairment, there is an end of life component to consider. And it was just my distinct honor to be there at the end of life. Again, I would try to pair my visits with the patients and their family members as best as I could to really facilitate that positive association. Because, I mean, end of life can be so emotional and so challenging. And especially for the memory care patients, they didn't really have a lot of those emotions to hold because their memory was so impaired. And so their family members were often carrying that on their own. So it was really a beautiful way to let the family members express their feelings, their emotions, their memories of their loved one on hospice care. And I also noticed that because music affects your brain in so many different ways, a lot of people remember music until the very end of life. And so I had patients who did not remember their family, who did not really remember who they were, where they were, but they could sing along or hum along to the songs that they had listened to in their teen years or in their 20s, those songs that really meant a lot to them over the years and over time, and they associated with those really nice memories. They were able to really continue to sing that music. So those moments were incredibly powerful, and I had several family experiences. I would say that was my favorite. I had great connection with patients and clients one-on-one, but to have their families there was just that next level of special, next level of amazing. And how these sessions would look is that I would come in, make sure to assess the patient. So every single day, you want to make sure that they can tolerate music therapy, that's actually going to be a positive experience for them. You don't want to agitate someone. Sometimes music can help them become more relaxed if they are in an agitated state. And other times, any sort of stimulation, whether it's really positive, such as music, or whatever, it can be overstimulating. So there were a few times where I had to assess my patients and decide to come back another day. But a lot of times I was able to assess in the moment, hey, are they going to benefit from music therapy today? We might even try a little bit and see how it goes. So I did love those one-on-one visits, but especially pairing them with bringing the children of the patients was amazing. Because again, I could play the songs, they could see their mom or dad or family member singing along. It brought them a lot of joy to see them engaged, to see them remembering something. And then they could share their special memories from the song or the experience or their childhood listening to these songs with their family. You can also create songwriting together. So that's something I facilitated at times, was either writing an original song, so something totally from scratch, or also taking a song that you might know, changing some of the words to customize it to the experience of the family. There was a song that I played for this one older woman and her son, and she was a proficient cook. She loved to show her love through cooking for the family and being able to share that gift with them. And in her memory impairment and in her older age, she wasn't able to share that gift as much. So it was a really positive memory of the past for the family. So I was able to take a song that we had sung a lot of times and change some of the lyrics to be her popular recipes that she would make. And I was given the gift that this family ended up giving me her personal recipes. And it was so special and such a surprise that they were able to share her legacy with me in this way. And I was able to recreate something that she created on her own. So that was another really, really special story that I had throughout time. So being a music therapist can bring so many positive things. It can bring a lot of difficult emotions too, especially depending on what population you're working with. But it's a great field, it's a great modality, and something that, again, is very widespread now. So if you ever have any family members or friends that might be in the hospital, that might be in end of life care, or might be in the education setting, wherever a music therapist could be, you can always request services. And depending on how the hospital or how the facility does things, they can provide that referral. So just knowing that it exists is really helpful, and knowing that it makes such an impact is really, really helpful as well. So I hope that this encourages you to learn more about music therapy and also discover where it might already be there. So thank you so much. All right, I'm just going to check on any questions. Yes, I love it. And of course, what would a music therapy presentation be without a song? I mean, come on, that would be ludicrous if I didn't play something for you guys. So I want to share a song with y'all. And let me just pull everything up. Of course, I just exited out. 1 second. Okay, there we go. All right, so I'll share a song and then we will be complete for today. Let me test this sound. Okay, here we go. Should be able to hear me play. Blackbird singing in the dead of night. Take these sunken eyes and learn to see all your life. You were only waiting for this moment to be free. Blackbird singing in the dead of night. Take these broken wings and learn to fly. All your life, you were only waiting for this moment to arrive. Blackbird fly. Blackbird fly into the light of a dark black night. Blackbird fly. Blackbird fly into the light of a dark black night. Blackbird singing in the dead of night. Take these sunken eyes and learn to see all your life. You were only waiting for this moment to be free. You were only waiting for this moment to be free. You were only waiting for this moment to be free. Yay! All right, let's turn off this echo.
That was great.
Oh, thank you guys. Thank you so much for being here with me today and learning more about music therapy. And yeah, I'm so excited. Do either of you have any questions for me or any stories to share? Have you experienced music therapy before?